Well, since maybe I was a young child, I had one or two experiences with illness, and two of those relate to two of my siblings passing and dying from malaria, health problems. So that made me very curious to always begin to think about what illnesses, what diseases were, and then what health was, and wondering why we have diseases and what can be done to cure that. So right through growing up, teenage years and up to that, I always keep thinking about making the world a healthier place and seeing how we can prevent pain, how we can prevent diseases and make people more happier and not having to suffer a loss. And that still keeps me up even at this age, and even after becoming a doctor in Sierra Leone, practicing in hospital, seeing the day-to-day challenges of drugs not being there. Sometimes you know the diagnosis of the patient, but you don't necessarily able to help because the funds are not there or the materials are not there. So that kind of like kept me up and kept thinking, and I said, no, I think I have to figure out what I could be or where I could be to be able to help or play my own part in supporting the health system in Sierra Leone, the health sector, to improve. And so after some more reflection, I thought that, okay, being a clinical doctor, being in the hospital, may probably not be sufficient to be able to contribute towards changing the narrative in Sierra Leone. So I found public health and I found health system strengthening and health financing. And I felt that, okay, there are still problems with health financing, funding the health system in Sierra Leone, but if some of these health financing problems are solved, then we can have a sustainable and a very resilient health system that's able to prevent diseases, save lives, and keep people happier. What's most interesting is, though, even though it's been a health system, health financing oriented fellowship, but I think what's been most impactful also is learning the leadership sessions and the leadership discussions, being able also to share the room with global health world leaders, people in civil society like Adrian, and then also people in organizational leadership. I think that stood out the most because sometimes there are a lot of ideas, there's a lot of passion to drive change. So sometimes you have a vision of where you want to go, but to be able to communicate, to be able to influence and lead that change, that vision, is a skills and arts that needed to be learned. And I think the fellowship and bringing that out is key. And I think it has been very helpful also to just reshape my thought and ideas about how to push on certain things, especially maybe on the policy that I'm working on. But the other thing that stood out also was the approach for the fellowship to challenge us to take projects, health reform topics that could also help move the needle in our health systems as reform agenda. And I particularly have looked at working on the free healthcare policy in Sierra Leone, which is targeting vulnerable population, especially women and children, and trying to give them access to healthcare. But what has been in question also is about sustainability of the scheme, being able to fund it, and for the country to take ownership from partner fund. And it's been very exciting working on the project, discussing it with colleagues in FAH and receiving their technical input and insight into developing the policy. I think what was most memorable about the Ethiopian visit was also being able to interact with the health system in Ethiopia. I think the way it was designed, that we were able to have interactions with colleagues in the Ministry of Health in Ethiopia, but also at the subnational level, down up to the facilities, and being able to see how their policies and are designed and the connection and the understanding of those policies from the national down to the facility level. And that being that also what's the policy objectives are practical, you can see the gains that are being made. For example, in the designing of the health financing, in the community health insurance, and how the facilities were actually getting reimbursed by that, and how that gives them autonomy in decision making and being able to address certain issues they face in the facilities. But it was also interesting to see how the health extension workers were part of the system and they were deeply recognized by the health system as well as also by the community in which they serve.